Welcome to the Women's Health and Fertility Podcast, the show where we explore the science, stories, and human experiences behind modern medicine and women's health. I'm your host, Dr. Tina Yang, and today we're diving into one of the most fascinating and life-changing areas of medicine, fertility. Joining me is a truly exceptional guest, Dr. Fangyin Meng. She is a distinguished reproductive endocrinologist and infertility specialist, as well as the co founder of a leading fertility practice dedicated to providing cutting edge, patient centered care. With extensive expertise in human embryo genetics, endometrial receptivity, and cryobiology, Dr. Meng has helped countless individuals and couples achieve their dreams of parenthood through a compassionate, personalized approach that blends science and empathy. Dr. Meng earned both her medical degree and PhD degrees as an honored student from Peking University Medical School, China's most prestigious medical institution. Her PhD research in human embryo genetics laid the groundwork for her innovative contributions to reproductive medicine. She went on to complete her obstetrics and gynecology residency at both Peking University First Hospital and the Albert Einstein College of Medicine, affiliated Bronx Lebanon Hospital Center, where she was recognized with the Best Resident Award and Surgical Skill Award. Dr. Meng then pursued a fellowship in reproductive endocrinology and infertility at Albert Einstein College of Medicine, further advancing her expertise in the science of fertility and reproductive health. Today, we'll be talking with Dr. Meng about the complex science of fertility, egg quality, chronic inflammation, and how lifestyle choices can influence reproductive outcomes. We'll also be discussing the emotional side of fertility care and what gives her hope for the future of reproductive medicine. So, whether you're a medical professional, someone navigating your own fertility journey, or simply curious about the incredible science of reproduction, this episode is for you. Welcome, Dr. Meng, to the Women's Health and Fertility Podcast. It's such a pleasure to have you as a guest today. And I can't thank you enough for this interview. I would love to start by asking you a little bit about your background story and what inspired you to specialize in reproductive endocrinology and infertility, and what continues you to motivate you in this field.
Thank you, Dr. Yang, and thank you for inviting me in this great opportunity to share my career story, personal story, and my really passion on this field. It was amazing and crazy. I actually almost made a decision to be a fertility doctor when I was 12 years old.
Wow.
Yeah, I still remember that day. I grew up in China, and one day when I was in the eighth grade, yes, eighth grade, I went to library and I saw a newspaper regarding the fertility IVF. I was like, wow, that's really cool. Nothing in this world can be like cooler than this kind of situation.
That's amazing.
Yeah, so I was like, I really want to be a doctor in this field to help women and help people. Yeah,
Well, it sounds like your inspiration came at such a young age.
very young age. And
Mhm.
then when I was in the medical school and I learned genetics, actually the most impressive field in medical school in my learning process was genetics and neurology. Okay, I was
Mhm.
like, these are very complicated and a lot of science and behind. So basically, I'm a science person, kind of. Yeah,
Mhm.
yeah. So
I
uh,
gathered that much based on your bio and all the research you've done.
yeah, yeah. And then in the medical field, especially in the fertility field, genetics plays a big, huge role.
Mhm.
And that's why after that medical school, I get my PhD degree on the genetics.
Mhm.
Yeah.
So, what actually motivated you to come over to the United States? I'm just curious because it sounds like you were doing some amazing work at Peking University, doing a lot of research, and really working on human embryo genetics. So, I'm
Mhm.
just curious what led you to the United States?
I think United States is a dream country for so many people, right? Yeah,
Hmm.
so many freedom and a lot of advanced technology.
Sure.
And I just had, have so many big questions in this field. Why some people's air quality is so poor and they are still young. Okay,
Right.
why this the first time trying works for somebody but not work for other people? Why
Hmm.
some eggs look so good by the morphology but they cannot be fertilized, right?
Right.
So
Right.
many, yeah, so many questions and so many things we still can do in this field.
Hmm.
And I think USA is the best country to fulfill a lot of people's dream to answer so many big questions and help other people.
Well, that makes a lot of sense, especially
Yeah.
because you have such a strong science background and you want to elevate, this
Yes.
medicine so much.
Yes. Hopefully. Yes.
For sure. So you've said that fertility science is one of the most complicated fields in the world. What makes it so fascinating for you?
Yeah, think about I tell this to almost like every my patients. Think about the human beings, okay? We evolution for like millions, 10 millions, 20 millions of years, okay? All of the species during this long time period, all of the evolution is focused on reproduction. Yeah,
Hmm.
think about that. If a person is sick, the simplest situation scenario in our field, we still cannot answer is for the breast cancer patient. Their
Hmm.
ovary function was okay before, and on the sad day, we diagnosed the breast cancer or any other significant disease, their ovary function dropped down significantly.
Hmm.
Yeah, even without chemotherapy. Okay, so our body works focused on the reproductive system. Okay,
Right.
that's all the species, the primary duty for their life. Of
Hmm.
course, not for human being, but for the whole like animal kingdom, right?
Hmm.
So our on the molecular level, on the endocrine level, um, genetics level, a lot of things, millions of factors that work together to make our reproductive stronger and to make our species stronger. So that's why in my in my life, in my mind, reproductive system and reproduction is the most complex,
Hmm.
yeah, most complex field in the medicine. All
Yeah, I really appreciate the way you explained that because reproduction is kind of like the core or the
yes,
center of
exactly.
many species. So, that is it's so motivating, I'm sure, for you and as scientists and doctors to continue down this road of discovery and advancement. So, you've had some amazing work in the human embryo genetics, and it's laid such a strong foundation for much of your career. How would you say embryo genetics shape the way fertility care is delivered today? I mean, it's
Yeah,
come such a long way.
yeah, exactly. So we know from the beginning that majority of the miscarriages is caused by the genetic issue, right?
Hmm.
And even before we have the pre-implantation genetic testing, at that time we do karyotyping for the miscarried tissues. We know that especially for the advanced age woman, 60 to 70% of the miscarriage caused by the genetic issue.
Right.
And we know that's for the chromosome numbers. And now the majority of the screening test, PGTA, is still focused on the chromosome numbers. We have more data at this time, like chromosome structures from the embryos, which potentially also the reason for the miscarriage or failed cycle. However, the chromosome number is still very fundamental, very basic information we get from the embryo. And we know each new embryo has basically at least 60 new mutations. And
Mm-hmm.
majority of these mutations, they are random mutations, right?
Uh-huh.
Yeah, we still cannot check these mutations yet. And we know there is 4% of the genes in our whole genomic information is related to the embryo implantation. So let's say we have 30,000 genes in each person. 4% is about 120 genes
Mhm.
in this whole genomic. And um, any gene mutation in these 100 genes, there is a possibility it can cause failed implantation. So that's
Right.
why it's very frustrated for some patients. I have 4AA embryo, day 5,
Right.
euploid, why I fail?
That's right.
And yeah, and that's a big issue in our field because that's not only the psychiatric burden for the patient and very frustrating also for the doctor too. And another thing we are facing for these kind of questions is like, is the embryo issue or uterus issue or
Mhm.
chronic inflammation or other things,
Yes.
right?
Right.
So
Right.
yeah, that's a big black box, and we do not have the very good answer at this time
Mhm.
for the patient yet. And sometimes we just tell the patient, let's try another cycle. Okay.
Sure.
So yeah, some patient they have multiple good embryos. Yes, they can try. Let's see if patient only have one embryo, right? That's heartbroken for the patient. And
Right.
if we are saying like, let's dig more what's happening, okay, let's check your uterus, let's check anything else. A lot of workup in the clinic is not very does not have very strong evidence behind. And it's let's see if we have like some minor findings, then the patient facing is like, is this minor findings is really a reason, or that's
Mhm.
the coincidence for this situation,
Right.
right?
Right.
So that's very difficult for the patient and physicians as well. So in my personal opinion, I think this like implantation related mutations, we need put more effort to figure it
Mm.
out, to
Mhm.
to improve the implantation rate
Sure.
and improve the success rate step by step.
Right, right. Well, and so this kind of leads me to one of my next questions. In our practice, we see a large population of like egg quality issues in our
Mhm,
patients,
mhm,
whether these patients are trying naturally with like first trimester pregnancy losses or recurrent
mhm,
loss, or they're
mhm,
going through IVF with challenges in getting genetically normal embryos. You
mhm.
know, egg quality is such an important factor in fertility. What would you say influences egg quality the most, and how can patients improve on egg quality? What have you seen in your practice, Dr. Meng?
Yeah, yeah. So this is a multiple phase question actually.
Hmm.
So we know some facts from the clinical practice. For example, last year I have two 45 years old patients. They do not have euploid embryos from
Hmm.
multiple cycles.
Okay.
And obviously, that's part of the egg quality, right?
Right.
And I talked to the patient. I said, currently, the technique is not perfect. Okay.
Hmm.
Sometimes the embryo cannot survive outside of body. Okay.
That's right.
Because no labs is better than your than your body than
Right.
your
Right.
uterus. So we tried day 3 without testing, and
Okay.
both of them are pregnant successfully.
Wonderful.
Yeah.
That's
So
amazing.
yeah,
Congratulations to
thank
them and
you.
you.
Yes, yes, thank you. And of course, we are very happy with this outcome. So this is, I would say, this is one part of the egg quality, which means the egg quality we saw under the microscope. Okay, even the culture under cultural condition. Generally, we see like, oh, your embryo is cannot go through to day 5. That means the egg quality is not that good. Okay.
Right.
However, we
Okay.
have to keep in mind this must be personalized. Okay.
Sure.
For some advanced age patient, everyone like past 42, 43, their egg are not as strong as before. Okay.
Sure.
For this kind of situation, what we saw not necessarily the real for the egg. We just need to find the kind of optimized environment for these eggs, for these
Right.
embryos. Okay. However, on the other side, we also saw some young patients. Okay. They have multiple eggs by their personal history, by their age, we're not expecting when the egg comes out, these eggs are super dark. These
Right.
eggs
Right.
cannot be fertilized.
Hmm.
This egg even stop before day three. Okay, so that's obviously this eggs the quality is not age related. They are some like lifestyle
Sure.
related poor
Do you see
quality.
that more prevalent in patients that have PCOS, polycystic ovarian syndrome, and endometriosis? Or
Uh,
maybe undiagnosed endometriosis, I should say.
exactly. Yeah.
Mhm.
So I would say PCOS is a huge population and the variation is big.
Mhm.
Um, in my personal limited experience, I feel like probably 20% of the PCOS patient, their air quality is unexpected poor, okay,
Mhm.
or not as good as their same age other
Sure.
patient.
Right.
For the endometriosis patient is a huge issue. And
Mhm.
I always talk to my patients who has endometriosis or unexplained infertility, because my feeling is at least 50% of the endometriosis patient, their egg quality are unpredicted.
Sure.
Okay, in some aspect, first, probably their egg numbers are fine, but maturation rate is sometimes an issue. Not for everyone. Some
Mhm.
endometriosis patient, their maturation rate, the nuclear DNA maturation, okay, is lower compared to other people.
Yeah.
And the embryo quality is not comparable to other
Right.
patients.
That's
Yeah.
interesting because I've seen that pattern as well in our practice. So I was just curious to see what, if it lines up in your practice as well. And may I ask you, going back to the two 45-year-old patients that were
Yeah.
blessed with
Yeah.
babies through day three embryos, were those frozen or fresh transfers?
Frozen.
Frozen transfers.
Yeah.
Okay.
Yeah.
And my second question is, were multiple embryos transferred during the
I
cycle?
did. I did. So for that, both of that patients, I was conservative because I'm afraid if twins happen, right?
Mhm.
So
Sure.
yeah, I transferred two, both of them. I transferred two day three embryos, and
Okay.
they get
Um,
pregnant. But one
okay.
of them, the second time, two embryo transfers. And so from this year, starting from this year, for this kind of situation, probably I will transfer four day three embryos each time.
Wow. Okay.
Yeah,
And
just
and why the change, Dr. Meng?
because of course I have failed patient, and I feel like four is the chance for the twins is super low. Okay,
Sure.
and decrease their financial burden, decrease their actions again for the embryo transfer.
Right, right.
Yeah.
And I think for women that are in their 40s, they've already gone through so much. I mean, their
Yes.
fertility journey has been so challenging.
Very,
So
very
to be
challenging.
able
Yeah.
to decrease the number of cycles, I think is ideal on a
Yeah.
psychological and
Yeah.
emotional
Exactly.
level.
Yeah.
So if you transfer the four embryos, are most of them blastocysts? I mean, are they like, oh, well, they're day three, never mind.
Yeah.
Scratch that I said that. But I would imagine you would transfer them all with different gradings, right? For day three.
Yes, yes.
Okay.
And go back to that story. That patient, the first time I transferred two best day three embryos, and she didn't get pregnant.
Mm,
And she only have two day three. One is 4 cell, one is 6 cell, and has fragmentations. So let me explain a little bit. So day three embryos, we think the best day three embryos is has between 6 to 12 cells. Okay,
okay.
so more cells in the embryo, we think more active, right?
Right.
So
Right.
4 cell day three embryos are not that great. Okay, and so before the embryo transfer, I even have conversation with the patient. I said, do you still want to try? Very honestly, I don't think you have very high chance. Okay, and she's like, this is my last time. Okay,
Hmm.
if I fail, I move on in my life. And so I did embryo transfer, and she asked our cute embryologist, she asked, like, do I still have chance? And my embryologist told her, you know what? When I load embryo, I saw a rainbow. That's
Wow,
a
I
very
love
good
that
sign.
story.
Yeah. And let's keep fingers crossed. Very
Sure,
honestly, from the traditional embryo grading, they are not the best embryo.
sure.
However, we hope the best. And she
Right,
got
right.
pregnant.
That's amazing. And
Yeah,
that's so awesome. And like you
yeah,
said, embryos do better in vivo
exactly.
sometimes, right?
Sometimes, yeah.
And, I've been practicing for 25 years now, Dr. Meng. So when I started doing acupuncture support for IVF
Hmm.
transfers, it was
Hmm.
only fresh day three embryos. That's
Yeah,
that's what we were
wow.
working with. So,
Yeah. You
so much
witnessed
has,
the whole progress of the
yeah,
almost
it
the
has
whole progress
changed
of
so
IVF.
much.
Yeah, yeah.
So, I mean, back when I started, that's all we knew was day three
Yeah, yeah. That's all the
transfers.
technique we had at that time. Like we do not have ability to culture the embryo to blastocyst.
Right,
Yeah,
right.
yeah.
So here's my other question about your protocols. I hope you don't mind me asking because I have a
No.
lot of patients that fall
Hmm.
in that category where they're like
Hmm.
in their, early to mid 40s and their ovarian reserve also is obviously diminished and
Hmm.
they just have their antral follicle count's low. They just have a few follicles
Hmm.
um, each time they go in for an ultrasound. Are you using more of a mini IVF type protocol with these patients for these day three transfers?
Um, Day three ovarian stimulation. I mean, for this patient, ovarian stimulation, right?
I'm
Not the
just
embryo
curious of
transfer
like the protocols because I know
protocol.
that
Okay.
there's medication wise, there's so many
Hmm.
different options
Hmm. Hmm.
for patients. So I'm just curious to ask you about like, do you see one protocol that's more effective in cases like this where you're planning to do day three
Yes.
transfers?
Yeah, so for this, if let's dissect this question for two different
Sure.
parts. Yeah,
Hmm.
the first part is organ stimulation. For the patient, I offer several different protocols. Okay, I have a patient starting on 39 for the IVF and multiple cycles until she is 41
Hmm.
because she want embryo banking. Okay, I saw the ovary function goes down gradually, and for these kind of patients, there are several things keep in mind. First, their follicles developing faster compared to other people.
Sure.
So yeah, so generally like textbook stimulation protocol, when I saw a patient on menstrual cycle day two, day three, the biggest follicle is 5, 6 milliliters, right?
Sure.
For this kind of patients, generally on day two, day three, the biggest already like 9, 10
Hmm.
milliliters.
Right. They have a lead
So
follicle already. Yeah.
already developed.
Right.
Yeah.
Right.
So generally, I give these patients two different choices. One is we stim at the luteal phase before start menstrual cycle. Yeah, so this protocol works for some patients. We just do stim earlier, like 1 week before the menstrual cycle. At that time, the follicles are still small, so they are more homogeneous during the stimulation cycle
Say that one more
process.
time, Dr. Meng. What
Yeah,
do you do the 1 week before the
one
menstrual
week
cycle?
before the menstrual cycle, when the patient is still in the luteal phase,
Sure.
not the follicular phase,
Right, right.
we
So you would
start.
start the protocol then.
Yeah, we
Ah,
start
okay.
protocol at that time.
Gotcha. Hmm.
So the goal, the logic behind is because their follicles start grow actually before the menstrual cycle.
Sure.
When we start at the time point of the menstrual cycle, one follicle or two follicles already dominant.
Right.
So then it's very hard to recruit other small
Hmm.
follicles.
Hmm.
Yeah. So that's why I start before the
That
menstrual
makes
cycle,
sense.
1 week start.
Sure.
Another protocol I also use is called estradiol priming and antagonist
Hmm.
protocol with the similar idea. So I before start menstrual cycle, I give estrus to suppress the FSH. So hopefully they do not develop dominant follicle during
Hmm.
that week before menstrual cycle. But for this kind of population, 41, 42, even a little bit like 43 or above, the most often situation is their body is very sensitive to this estradiol. And if I give them estradiol, so kind of his dilemma. If we do not give them estradiol, they develop dominant follicle. If they give them the estradiol, suppress the FSH, AFC is gone. The small follicle is gone.
Mm,
And so that's why let's combine this kind of protocol. If you give the estradiol, suppress FSH, and just be patient. Give them some antagonist when they start menstrual cycle. Give them time to recruit the follicle and then start. Recently, I had 46 years old woman. Her organ function is very good compared to majority of the 46 women. And I saw about 8 follicles random at the random time. And
mhm.
I gave her estradiol priming, and no surprise, after estradiol priming, when she started menstrual cycle, I cannot see the follicle at all. All of them
Right.
gone. Okay.
Sure.
And I said, let's start antagonist 7 days. Let's wait.
Okay.
And after 7 days of antagonist, I saw 8 AFC and start stimulation. Eventually, I
Wonderful.
get 10
Yeah. So slow and
M2X.
steady.
Yes.
Hmm.
Yeah. Yeah. So of course, we have some good outcome examples. Some patient does not work. So for this kind of population, it's really personalized protocol. So
Sure.
just based on the logic, how does their body functioning, and multiple ultrasound to observe how do their follicle cohort comes and goes, and just work with that with their body, um, with these
That's
cohorts.
wonderful, Dr. Meng, because every woman is so different, right? And
Yeah,
every cycle is so different how your body's going to
exactly.
respond to
Yeah.
medication. So for these patients, is omnitrope or human growth hormone something that's even an option in a cycle like this?
Yes, the growth hormone is, I'm still working on that.
Okay.
Yeah, so previously I adopted a protocol from my previous practice, which is standard growth hormone for 4 days during the first stage of the stimulation. Okay, so if you think about this molecular pathway, um, the eggs need growth hormone when get a certain size. Basically,
Mhm.
it's after 10 milliliters of the follicle.
Sure.
Okay, so I totally agree. Some patients they need growth hormone even during the late stage of stimulation. Okay, however, if you take a look of these molecules, how do they work together? It looks like it's also supposed to be also work during the very early stage. So I know in the Europe, there are protocols, they are using growth hormone like 1 or 2 months before the stimulation. Okay.
Right.
I do not have the strong data to support its benefit or its not benefit. However, recently I saw outside monitor patient. I like to talk to the patient. Yeah. So I asked her story, and she told me it's amazing. I cannot tell that's the reason and the consequence, or that's the coincidence. What she told me is she had IVF cycle 4 or 5 years ago when she was 36. And she had 2 IVF cycles. And during that time, every time she get 8 or 10 eggs. And she failed that 2 cycles, no eubuly. Okay,
Mm-hmm.
so that's why she stopped and she restart this year. She is already 40 something, and between 40 to 41. And she used growth hormone for 1 month, and then she started the IVF cycle.
Mm-hmm.
She got 24x,
Wow.
full
That's a
euploid
huge
embryo.
difference.
Huge difference.
Sure.
Okay, yeah, and yeah, because this difference is so big, and I cannot believe that's the coincidence.
Well,
Yeah.
Dr. Meng, I've actually seen some natural fertility patients get a hold of omnitrope just to help with their egg quality even when trying naturally.
Mhm.
So, and unfortunately, omnitrope is a very expensive
Expensive. That's the issue. Yeah.
medication. So
Yeah.
I
And
think
that's
that provides limitations
Yeah.
for patients in the United States to be able
Exactly.
to
Yeah.
to take it for longer periods of time, right?
Exactly. Yeah. Yeah.
So hopefully that will change and a
Yes.
generic version will be
Yeah.
available, which will make
Yeah.
it,
Yeah.
more accessible, right?
Did you see the difference for the natural conceiving patient use Omnitrope or
I
do not?
did.
You
Actually,
did.
this particular patient
Wow.
was in her early 40s. She
Uh-huh.
had failed two IVF cycles, nor no
Okay.
her embryos ceased to grow. She couldn't even make it to blastocyst, so no genetic testing at all.
Mm-hmm.
And the reason why she had to do IVF was because her husband had a vasectomy, had a previous
Gotcha.
marriage.
Mm-hmm.
And so they did that. And so because those cycles were unsuccessful, he decided to do a vasectomy reversal, and
Okay.
they decided to just start trying naturally. So in the
Mm-hmm.
meantime, she started using Omnitrope while
Okay.
he was recovering from the
Uh-huh.
surgery of the reversed
Mm-hmm.
vasectomy. And so they actually conceived naturally.
Nice. May I
Yeah,
ask, what's the
and
dosage and how long did she
that
use?
I don't remember exactly.
Okay.
It's been a while, but I will
Okay.
say the first pregnancy unfortunately ended up in a first trimester miscarriage. But
Heartbroken.
then,
Sorry for
they
that.
recovered, and
Mm-hmm.
yeah, it was very disappointing, but I think it gave them hope that it was possible, right?
Yeah. Yeah.
Because she had
Of
already
course.
gone through, several rounds of IVF that
Mm-hmm.
were not
Mm-hmm.
successful.
Mm-hmm.
So after she recovered, both emotionally and physically, they started trying again.
Mm-hmm.
And this time they conceived naturally, and they had a very healthy
Nice.
pregnancy and had a baby boy, who's now probably, let's see, he's probably about 2.5 now. So I
Wow.
have seen patients use Omnitrope that way,
Mm-hmm.
but somehow she was able to get a prescription, that she was
Mm-hmm.
able to extend the period of time that she was taking her Omnitrope.
Yeah.
So, but yes, I'm excited to see what the future holds for
Yeah.
Omnitrope, both with IVF as well as for natural fertility or even IUI cycles. So
May I
this is
ask a
going to be
question?
yes, yes,
Yeah.
Dr.
So, what did you do magically to help the male partner for this case?
Okay, well, they were very, very compliant patients. So
Mm-hmm.
they both came very regularly for acupuncture,
Okay.
at least once
Yeah.
or twice a week.
Mm-hmm.
He followed a very clean diet, an
Mm-hmm.
anti-inflammatory diet.
Mm-hmm.
He took all his antioxidants, right,
Mm-hmm.
that we recommended for male fertility.
Mm-hmm.
He also was on Chinese herbs,
Okay.
and she also was on Chinese herbs as well
Mm-hmm.
for a period of time. So this was like even before their first pregnancy, they were seeing
Mm-hmm.
me for 2 to 3 months before.
Gotcha. Yeah.
So there was that. And he was under the care of a urologist. So he was
Mm-hmm.
on a protocol of Clomid and
Mm-hmm.
HGH as well.
Okay.
So there
Okay.
that was involved as well.
Yeah.
His the typical urology protocol.
Yeah.
Hmm.
I think this is super important for some patient. I had another patient who was when she saw me, she was 35, 36.
Hmm.
She had six failed IVF cycles.
Oh, that's a
Yeah,
lot. Yeah.
yeah. Very obviously poor egg quality. And she was super stressed, not only because of the failed IVF, also because of her career and lifestyle. She
Mm-hmm.
is a she is a very successful woman. She owns seven different companies, and
Wow.
yeah, she only sleep like 4 to 5 hours a
Hmm.
day for years. Okay, so for some of the chronic, unexplained or very poor egg qualities, I think this kind of patient really need like help from your team for control this chronic inflammation and improve the egg quality. For that specific case, I really don't believe that's the genetic issues cause the
Sure.
poor
It's more of a
egg quality.
lifestyle
Yes, yes,
situation.
yeah. And
Yes.
we see this on the endometriosis patient too. Yeah,
Hmm.
yeah.
Hmm. Well, thank you for pointing that out, Dr. Meng. I was just going to ask you what your experience was in working with, Chinese medicine doctors and acupuncturists and other natural medicine providers, and if you've had success in seeing improvement in egg quality and IVF outcomes.
Mhm. Yeah. So I do not, it's not like on the top of my head, but we know from the data analysis and from our personal experience, right? So um, like stress level, okay, shortness of the sleeping, okay,
Hmm.
especially like night shift and not that clean diet. All of
Right.
the things cause the chronic inflammatory situation. And from the clinic practice, I would say both PCOS and the endometriosis patient, they are just the mix of the situation. They are not
Hmm.
homogeneous, especially my experience for endometriosis patient. You saw some endometriosis patient is a quality issue, some is implantation issue, some are both. Right. So we saw this kind of patient benefit from the acupuncture, from the clean diet, from the lifestyle change.
Right,
Yeah.
right. That makes a lot of sense. And, we say too, a lot of times when patients are burning the candle at both ends, like you were mentioning, night shifts, not
Yeah.
sleeping enough, or not having regular sleep and diet and
Hmm.
dietary habits,
Yeah.
that it pays a toll
Yeah.
eventually on their
Yeah.
body. So it can
Exactly.
cause, elevated cortisol levels, and it could create more inflammation in their body, gut health issues, which is a whole another topic in itself.
Yeah.
But I'm really curious to know, Dr. Meng, because you did a lot of your training in China,
Hmm.
and Chinese medicine is, so well known to help
Hmm.
with women's health and fertility. What
Hmm.
what types of things did you see when you were going through your training?
Yeah. So I during that was 25 years ago. Okay. Let me share some the
You
new
look too young
experience.
for it to be 25
Oh,
years
thank you.
ago.
Let me share some new experience I just learned. Amazing, you know. So I had a patient, she had multiple IVF cycles in China. And
Hmm.
you know what? In China, a lot of IVF doctors, they are testing the chronic inflammatory markers. They are respond on that.
Okay.
And yeah, and this patient specifically told me like every time if she is using HRT FET cycle, her TNF increased significantly. And
Ah,
she failed.
okay. Uh-huh.
Yeah, that's very like I'm curious. I do not have this kind of data. I need to talk to Chinese doctor regarding this. Do they have strong data to support against
Sure.
all these kind of
Yeah.
the markers? That's also one of the questions I want to ask you. Do you have any experience on this? And I'm also thinking about I'm going to adopt this protocol and to test my patient. Probably we can screen some patients. They have like higher inflammatory marker and they could benefit more from the acupuncture and the herb treatment before
Right,
the
right.
IVF
I
or
would love
during
that.
the
I would
yeah
love to
during
to
the
learn
embryo
more about
transfer.
that for
Yeah,
sure. And that was
yeah,
actually one of my questions too, because you mentioned that chronic inflammation can be like a hidden contributor to
yeah.
infertility. So I wanted to ask you, are there certain tests or procedures that you have found that are beneficial in detecting chronic inflammation?
That's the project in progress.
Okay. Okay. And
Yeah.
I'm sure there's probably multiple tests. There's
Yes.
not just
Yeah.
one
Yeah.
test or one
Um,
procedure.
Yeah, I'm contact the doctors in China. They did more on this, and I'm
Okay.
also like,
Fascinating.
yeah, I'm also like trying to adopt choosing from this the whole big panel
Sure.
because the situation is different for the patients over here and
Hmm.
compared to other country, our medical cost is so high, right? So I
Right,
have to
right.
tailor to balance the financial burden and really benefit for the patient and the limited knowledge I have now and from the experience the patient told me one is IL-6, one is TNF, which probably I will start with. And
Okay,
I will,
great.
if I get the primary data, I will share with you.
Yes, please. Thank
Yeah,
you.
and we can try the acupuncture or like herb medications. Hopefully, this kind of the treatment can decrease this inflammatory process and hopefully it can benefit the patient.
Well, I love that you have access to other doctors and scientists in China where you can ask them these
Yeah,
questions and pick their
yeah.
brains and ask them like, okay, which test did you order and how long did you treat,
The
whatever
patient on this.
anti-inflammatory
Yes.
protocol with
Yeah.
acupuncture and herbs before, they jumped
Yeah.
into a cycle.
Yeah.
I'm just, when I think about inflammation
Hmm.
shows up in so many ways, right? So
Yes.
when I'm seeing patients, anytime I think about digestion problems,
Hmm.
chronic eczema, skin issues,
Hmm.
allergies, like to me, that's already someone that has inflammation
Yeah.
problems,
Yeah,
right?
exactly. That's already the evidence. Yeah.
Sure. And then the other
Yeah.
thing I know that the ERA testing and the endometritis testing, which is very common
Hmm.
for the FET piece
Hmm.
of transfers
Hmm.
protocols. To me, when endometritis comes up, that's already a red flag right there,
Yes.
right?
Yes.
And
Yeah.
like, okay, maybe we need to think about taking a little bit more time before we transfer, even
Hmm.
after the traditional treatment protocol
Yeah.
of
Yeah.
antibiotics, right?
Yeah. Yeah.
So those are kind of some of the things that I think about when I'm
Hmm.
treating patients and just
Hmm.
looking for those different signs and
Hmm.
symptoms. And even if a patient hasn't been diagnosed for endometriosis, or PCOS, and I know that they're starting to they show signs and symptoms, or if maybe they have really chronically heavy, painful, clotting menstrual cycles, to me, I'm already starting to treat their inflammation
Great. Yeah.
immediately.
Great. Yeah.
So I don't know if there's anything else that you've seen or any other markers that you look for in your treatment protocols that you find are indications or like confirmation of chronic inflammation.
I think you are already the expert on this field. And I would say all of the endometriosis patient, they have chronic inflammatory situation.
Sure.
Yeah, even like this population is heterogeneous. And
Hmm.
when I do the hysteroscopy, I put the camera into the uterus, I saw the different things, but I would say
Yeah.
majority of them, they have the inflammatory reactions in the endometrium.
Hmm.
Sometimes I saw so many micro polyps, and
Wow.
sometimes, yeah, it's happened very often for the endometriosis patient, even like as you said, undiagnosed. And if like you give me these pictures, let me guess, I think the accurate rate is about 50%. Yeah,
Uh-huh.
so it's
Yeah,
it's
right.
pretty common. Yeah,
Okay.
and also some patient they even endometriosis patient even they do not have the symptoms of the pain, and when you take a look of the inside of the uterus, you saw the no, strawberry-like inflammation here and
Hmm.
there. Yeah, and we know that PCOS patient has the chronic inflammatory situation, and also, you know, the obese, somehow some obese patient, it's when we take the eggs, I have more than one case. The only thing I can find is obesity. And
Uh-huh.
when we took the eggs out, it's surprisingly poor quality. Yeah. And after we asked them to take the acupuncture herbs, lost the body weight, the egg quality improved.
Right.
Yeah.
Right.
Yeah.
That makes sense because of the
Yeah.
insulin and blood sugar dysregulation, most
Yeah.
likely, that's
Yeah.
happening,
Yeah.
affecting the hormones too.
Exactly.
What about for your patients with autoimmune issues?
The autoimmune issues is I do not have like a huge experience on the severe autoimmune disease, but for some patients have thyroid function
Hmm.
problems. Um, I personally didn't observe like that's the huge impact on the egg quality. However, it's a concern during the embryo transfer. Generally, I like regulate their thyroid function before the embryo transfer. And we know that if has autoantibody to the thyroid,
Hmm.
that's the risk factors for the
Sure.
miscarriage. Yes,
Right, right.
yeah, yeah. I had a patient actually that was a gestational carrier, and I know that's her because for the patient, she had a miscarriage twice with the same IP, and we eventually we changed a gestational carrier, and I successful
Mm,
pregnancy.
right.
So that must be her.
Sure.
And what we found is anti-thyroid antibody.
Okay.
Yeah.
And yeah, and is that typically something that's screened for
Yeah.
gestational carriers
Yeah. Yeah. Yeah.
beforehand?
Yeah.
Yeah.
Beforehand. Yeah.
That makes a lot of sense then, so
Yeah.
that it's really more impacting the implantation
Yes,
process.
that's right. Yeah.
Well, I'm also just thinking too with autoimmune conditions such as like Hashimoto's and, lupus, like these are
Hmm.
inflammatory
Yeah,
conditions
that's
too.
the
So,
yeah, that's a huge inflammatory
mhm.
situation. Yeah. Yeah.
Yeah. Well, thank you so much, Dr. Meng. This has been such an enlightening conversation. You have such a wealth of knowledge.
Thank
I,
you.
I do want to ask you just a few last questions.
Sure.
Do you have anything you would like to share about emerging advancements that are coming out? Since I know that you are heavily involved in science and research. Anything on like embryo testing or endometrial receptivity research?
Yeah, sure. So let me clarify this question. So, are you asking, do I have more some events come up, or you have some events do I want to join?
No,
Which
no,
question
for you.
oh,
If the
for me?
knowledge that you have or anything
Uh,
that you're developing or, you know, you're, if you are involved in any of this research.
Okay.
Hmm.
Yeah. So we are developing because of the connection in China and
Hmm.
also the advantage for research in China because they have huge populations, right?
Sure. Yeah.
It's easier to get data and to get
Hmm.
the comparison. So I just had a new paper published comparing different stimulation protocol. And
Wonderful.
we are also work on the different FET protocols on the endometriosis patient, which benefit them more on the success rate.
Amazing. So this
Yeah.
is published in English or in
In
Chinese?
English, it's a Asian journal, but it's
Okay.
published in English. Yes.
Okay, wonderful. Is
Yeah.
this available through PubMed, Dr. Ming?
Yes, it
Okay,
does. I
great.
can send you a copy
That'd
later.
be wonderful. I
Yeah.
will
Yeah.
add the link to your
Thank
your
you.
research paper
Yeah. Yeah.
on
Thank
the
you.
podcast show
Yeah.
notes. So, final question. Is there
Sure.
any message or advice that you have to share with individuals or couples that are beginning their fertility journey?
Yeah, sure. So, um, several things. The fertility journey is very emotional and very stressful. And scientifically, of course, several things we cannot change. Genes and age, we cannot change, right? However, several things we can change. Okay. And we need to help ourselves to improve the egg quality, sperm quality to make the life easier. Okay. And this, just as you well said, the diet, lifestyle, sleep, exercise. By the way, I'm a huge fan for exercise. Okay. I told every my patient
Great.
you need exercise 5 times a week. Yeah.
Nice. I love
Yeah.
that.
Yeah. And acupuncture, this kind of something they feel like a lot of people feel like this is small things, but these small things, they if we put them together, they are huge impact
That's
on the
right.
outcome. Yeah,
Hmm.
yeah.
Well, thank you. Thank you for sharing that. And Dr. Ming, is there anything that you have upcoming? I know you mentioned that you guys will be opening up your new location for
Yes,
South Coast
yes,
Fertility Specialists.
yes.
Very excited for that.
Very exciting. Yes.
Yes,
And new lab. Our
and a
goal
new
is,
lab.
yes, our goal is to provide the best service to the patients. I just feel like I have a strong passion in this field. Sometimes I just too emotional. Sometimes if my patient feel, I feel very, very sad. So yeah, I cannot tolerate like if like any step is not perfect, I cannot tolerate. I just feel like patient already went through so much. Their life is
Right.
so hard. Yeah.
Well, Dr. Ming, it's so nice to be able to work with someone that has such a strong compassion and heart for their patients. And I think that makes such a big difference when you're going through this journey of IVF and fertility. infertility. And I think your patients are very lucky to have you
Thank you. Thank
as
you.
their
That's so
provider.
nice. Yeah.
I really mean that. It's so important. You guys make the biggest difference, and having the encouragement and the support of a doctor like yourself can
Thank you.
change everything. So, but again, thank you, Dr. Meng, for your time. I really appreciate you taking the time out of your busy schedule to be on my podcast.
Thank you. Thank you for your time too.
You're very welcome.